I am Lindsay Duncan. I'm an assistant professor here in the Department of Kinesiology and Physical Education. I'm also a member of the McGill Research Centre for Physical Activity and Health, as well as the Axis leader for the Psychology and Pedagogy of Sport and Exercise Axis. I am a researcher in the area of health psychology, and under that umbrella, I'm interested in sort of three main domains. And the first is understanding how we make decisions about our health behaviors and whether we're going to engage and how much we're going to do, those kinds of questions. I'm interested in figuring out the best ways to motivate or maybe even persuade people to change their health behaviors into something a little bit healthier for them. And then I'm also interested in finding the best ways to support people in maintaining health behaviors such as physical activity over the long term, particularly when they face challenges. And in that area, an example from my research is to figure out how to encourage people to be physically active once they're facing a cancer diagnosis. It's really important to try to find intervention approaches that are really tailored to the people that I'm working with and that really fit within the life that they're already living. So in the context of physical activity, physical activity is hard to do. So if we bring to people strategies that are, really burdensome, that's extra work to try to, change the behavior that they're already doing, or in many cases add in another behavior on top of what they've got going on in their day-to-day, it's too hard. So I'm really focused on finding strategies that just really fit within people's day-to-day lives and allow them to kind of pick up the behavior in an relatively easy way. So I think that our Axis makes a really valuable contribution to PATH because it can take the research that's happening in the area of physical activity and health and actually put it out there, take it into the streets and help to get people actually physically active. We know that physical activity is really important for maintaining our health over the lifespan, and it's the research of members of our Axis that can help sort of figure out how we can motivate and support that behavior over the long term. So when we start from pedagogy, pedagogy is really about trying to find the best ways to teach kids to be physically active in the beginning, help them develop those skills that they're going to be able to use throughout their lifetime, help them find activities that they enjoy doing, that they find sort of appropriately challenging for them. And if you can get kids kind of latched on to physical activities that they enjoy early on, then they're likely to be able to maintain that over the long term. And then the psychology folks within our Axis are really focused on some of those really fundamental questions about how do you motivate people over the long term, how do you help support the healthy behaviors, in particular when there are challenges to doing that, such as mobility impairments, changes to your life because of cancer or diagnosis with another chronic disease. I think people in our Axis can really help to answer those questions and pull everything together.